While most of the public was staying at home, being quarantined, doctors and nurses had no choice but to be exposed to the COVID virus, also putting their own family and friends at risk. ICU nurse Marissa Mulready talks about her experience working with COVID patients.
What hospital do you work in?
Valley View Hospital in Glenwood Springs, Colorado.
What is it?
Valley View Hospital.
Okay, yes, at Glenwood Springs, Colorado.
Mhm.
How are things going over there, Marissa?
I want to say it's kind of like a steady pace. So of COVID, um, I think like with the staff, it's just like sometimes it's, we just don't know what to expect every day. So it's just constant. I don't know.
Right. And are you concerned about, you know, like, is there enough guard wear for you guys to wear? Is there enough masks? Is there enough ventilators over there?
We have plenty of ventilators. We haven't been fully full, all of that. For ventilators, we haven't needed all of them. We do at the moment have enough protective wear at the moment. The hospital that I work at, they were prepping to have a shortage. So they actually went out and started making their own masks out of this, like when we sterilize stuff from the OR, we wrap it in this like blue paper. And that's what they've been using to make masks for when we run out of paper, like the paper ones.
Right. And now you're a type 1 diabetic, so you have to be doubly sure not to catch anything.
Yeah, I try not to think about it too much. If I start to think about it, I feel like I kind of go down like this rabbit hole of like, oh gosh, if I get it. But my blood sugars are really well controlled. So I don't have like an increased risk. I have like the same risk of everyone else. But I am afraid if I do get it, like how much worse could the symptoms be? Would it last longer? Because it usually takes diabetics longer to recover from things. So that's what I fear more than actually contracting it.
Right. What is there any pattern that you see? Like, what are the symptoms, or like basically, well, you're in the intensive care unit, so you probably see them when they have really bad symptoms, correct?
Yeah, there's usually it's like an older population. We haven't really seen a large younger population yet. It's usually older, have some comorbidities along with it. I think the hardest part is that, their family can't be in there with them because there's like a strict rule, no visitors. And for someone to be that sick and not have like family voices and, that family touch, I think that's the hardest part. And it's hard to see a patient be in there in a room alone all day and only getting interaction when we go in. It's sad.
Yeah, I can't even imagine what that would be like. Like, say if somebody came in without being on a ventilator, and then, having to make that last phone call to the family, and then
Mm-hmm.
actually putting them on a ventilator, and, having the phone right there and ring because the family is so concerned. Um,
Yeah.
it's heart-wrenching. It's heart-wrenching.
It is, and it's hard to like in the morning usually, like because I work nights, so I'll call the family in the morning and kind of give them an update and how things went, and you can just hear like the stress and the anxiety and the worry in their voice, and that's hard too. So
Right. Yeah. What is it? What is it like? Are the doctors and nurses? Because you guys are dealing with a disease that nobody's ever dealt with before. So really, nobody has any experience. Do you know what I'm
Mhm.
saying with it? So you're just kind
Yeah.
of trying different things and all that.
Well, I mean, I know for a fact that the CDC and the World Health Organization are constantly changing protocols every day. So it's hard to keep up with everything. It's hard to know if what we did yesterday was the right thing and if they change it the next day. It's a constant stream of, I don't know, is this the right thing? Will this change tomorrow? Will it change next week? Is this the right course of action? So that's difficult. So I think people get overwhelmed with that, like the amount of information that's coming at us constantly.
Mhm.
It's hard to keep up with it too. So we're doing the best we can.
Right, that's all you can do. What is the best part about being a nurse, an RN nurse, that you love to do, that you love doing? I mean, I know it's tough right now, but
Oh yeah, no, of course. But I mean, I still look. I mean, plus with the social distancing, I like look forward to going to work. um, even though it can be hard, but it's still. I still love doing it. I love taking care of people.
Mhm.
Love seeing them through their hard times and being there for them. They're really vulnerable at these times, and um, I mean, I know I'm not family, but it's nice to know that at least I care and I'm trying to do the best I can to make sure they get better and back home to their loved ones. So,
Right. Are you seeing people leaving there healthy, or is it the other way around?
I would say um, a little bit of both. I don't know. I don't want to say 100% healthy. Usually, sometime we'll get like a positive result. And if they're not in like a critical state, then they'll go home and kind of quarantine themselves. Um, but yes, there has been some cases where it's been, not the best outcome, but nothing like they've been seeing in like New York and stuff.
Right. Now, I think that all nurses, especially you, should have your college loans paid for being a nurse. What do you think? For
I
going
mean,
through
that would
this?
be nice. I
Yeah,
don't know
wouldn't
if
it?
it'll happen. Yeah. I don't know if it'll happen. It'd be nice.
Like I saw this one hospital. It was for disease, like it's a strictly disease hospital, and
Mhm.
one doctor or nurse, she took off a pair of gloves and she had another pair of gloves under her glove. Do you find that in there?
So yeah, for sure. Definitely. I definitely sometimes will double glove because, sometimes you'll go in and you have to, you know, get dirty and you don't want to touch clean things with dirty gloves. So you have to take those gloves off to have clean gloves underneath.
Now, you being a nurse, do you get, well, I mean, I know there's social distancing that's driving everybody nuts. I mean, I'm ready to
Mhm.
have a party online and get my Mai Tai drink out, you know?
Yeah.
Like, do you ever get friends that'll be like, oh, you're a nurse, I can't see you because I might get, you know what I mean?
Um, well, to be honest, because didn't grow up here, I haven't really experienced that. Most of my friends that I have out here in Colorado, are nurses.
Mhm.
But
So do you get together with them?
no, not really. To be honest, we've just been trying to keep our distance. Um, yeah, I don't really hang out with a lot of people, but I will Zoom with friends from back home a lot, which is nice, and FaceTime with my family and stuff like that. So
Well, I commend you for, being a nurse, and you're, being on the front lines right now. It's really, you're really earning your chops there.
thanks.
Talk about, yeah, really, it's just amazing, really. We're all hoping that we all get through this as quick as possible, hopefully.
I hope so.
Yeah. So I wanted to thank you for this interview.
Yeah, thank you.